following segment is sponsored by Intermountain Health. February is American Heart Month, a time when all people, especially women, are encouraged to focus on their cardiovascular health. Dr. Victoria Chase with Intermountain Health is here to discuss what women need to know about heart disease and pregnancy. Welcome to the show, doctor.
Thank you.
We're happy to have you. Okay, there is a common misconception that heart disease only affects men, but the fact is heart disease is the #1 killer of women. What are the factors that we need to consider?
So with women entering pregnancy, many have silent or unrecognized risk factors, the top two being hypertension and diabetes. And identifying these and treating them will lead to healthier and safer pregnancies.
Sure. Okay, and what do we need to know about heart disease and pregnancy combined? Is this his family history?
So this is often based on her history, and with heart disease and pregnancy, it is the leading killer of women, or maternal mortality, we say, for women across our country.
Okay, and is there anything we can do to lower our risk of heart disease while pregnant?
So identifying the risk factors, and also prior to pregnancy, if you have known cardiovascular disease, you could come to our pregnancy prevention, preparation, and risk evaluation clinic at Intermountain to evaluate your risk and have guidance on how to optimize your health before entering.
Sure.
pregnancy.
Okay, is there anything else you would suggest to do beforehand, and how long before should we do that?
It ideally would happen a number of months prior,
Okay.
and part of it depends on your health risk. Sometimes we recommend a delay in conception so that we can optimize blood pressure, optimize diabetes care, reduce weight, but sometimes we also have a woman come see us and we say, you are at a safe point and it's safe to proceed with pregnancy now.
Okay, good to know that we have options if we're pre-planning, things that we can do before getting pregnant. Is heart disease something we should consider even after delivery, and what signs should we be watching out for? You know, in my mind, I'm thinking, okay, while we're pregnant, but what about after?
Yes, so pregnancy is a stress test for cardiovascular disease. It often unmasks women who are at risk for hypertension later in life or stroke cardiovascular disease. It often unmasks women who are at risk for type 2 diabetes. And so pregnancy, if you develop these complications at that time, you should have regular follow-up with primary care doctors or our cardiovascular disease specialists after birth to ensure that you have optimal health across your lifetime.
Okay, that makes sense. If we feel like we're having a heart-related issue, you know, we're in the moment, we're like, okay, I'm feeling like this is happening. What's the first step we should take? What should we do?
I mean, the first step would obviously, if it is acute and severe, we would want you to call 911 and be seen in an emergency department. If it is something that is more of a chronic disease, starting with your primary care doctor or your OB specialist or midwife, and they would refer you on to maternal fetal medicine specialists as needed.
Okay, any signs that we're looking for really quick?
So anytime you have chest pain, pressure, racing heart, or severe shortness of breath that is different, those are all signs that we would want someone to be evaluated.
Sure, make sure to you pick up the phone and call 911
Yes.
just in case. Okay, where can we go for more information, doctor?
So intermountainhealth.org is our website, and maternal fetal medicine is our subspecialty group that deals with high-risk pregnancy.
Okay, thank you for all the info. It's great to see you. Thanks for being here, Dr. Chase.
Thank you.